Hi guys, I know we've seen the topic, we've seen the title, so we definitely know what this video is about. But before I start, I would like us to know a few things. And the first thing is that the urine is actually formed or are formed by the kidney by filtering the blood and extracting the waste and toxins, then delivered to the bladder through the urethra where it is stored. Now, the bladder, which acts as a reservoir, has a capacity that it can actually contain or store, and it varies in the individual from 300 mils to 600 mils, dependent, like I said, on the individual. And then also the bladder works hand in hand with the brain. That is, the bladder sends signal or communicate to the brain through the spinal cord. Now when the bladder is full, it sends message to the spinal cord through the spinal cord to the brain, and then tells the brain that, oh, I'm full low. That is when you will get the urge to urinate, and then you will go to the restroom to ease yourself. But if you're not in the right place or at the right, or it's not the right time, the brain will also communicate that, oh, you're not in the right place, hold it. That is why you're able to hold your urine till you get to a convenient place. And this also works even at night. When you get the urge to urinate, your brain will be like, no, you can't do this on the bed. But if this urge is quite tense or quite much, that is when you see yourself getting up from bed to actually go and urinate. Now there are things that can actually affect this communication between the bladder and the brain. The first thing is age. As one gets older, the muscles just tend to weaken. It's not how you hold your urine when you were young that you will when you get older. The second thing is the capacity of the bladder. Some people just have a large bladder, like I said, from 300 mils to 600 mils. So some people have a larger bladder while some don't. Another reason could be a neurological problem where your bladder can communicate to your brain, and this can be for various reasons. For instance, an accident that affects your spinal cord, or you have a problem with the nervous system as a whole, like multiple sclerosis, for instance. The reason could be that the person has problem with the bladder, like having a hyperactive bladder, for instance. The sixth reason I believe is having could be the drug that the person is taking. For instance, diuresis, that is a drug that helps people to produce more urine. Another reason could be anxiety, stress, or other psychological problems could actually contribute to this. Now, if you or anyone that you know is experiencing any of these signs that I see, experiencing any of this, please visit your doctor for proper evaluations. But just in case you can't visit your doctor right away for reasons best known to you, there are things you could try out. And then the first thing is to limit your water intake in the evening. This will make the body produce more or less urine. Another thing you could do is to empty your bladder before going to bed. The third thing you could try is behavioral technique. This will help train your bladder and also your pelvic floor muscles. The fourth thing you could try, or the fourth thing that is available, is drugs. So don't fail to visit your doctor to get treated, to get proper evaluation, proper examination. And if you find this video informative, if you find it useful, please do give it a thumbs up, and you could consider sharing it to others so that they could learn one or two. Thank you, and see you next time. Bye.